How to document crisis intervention sessions. Have you ever wondered how to effectively document crisis intervention sessions, especially when dealing with substance abuse? It's a vital skill that can make a big difference in treatment outcomes. Let's break down the essential steps to ensure your documentation is clear and effective. First, start with a detailed description of the crisis situation. Capture the specific event that led to the intervention. This could include signs of extreme agitation, suicidal thoughts, or symptoms of acute intoxication. Make sure to note what triggered the crisis and how the individual presented at that moment. Next, document the interventions that were applied. This includes the specific actions taken to manage the situation. For instance, did you conduct a safety assessment? Were dangerous items removed? Did you administer any emergency treatments, like Narcan for opioid overdoses? It is important to record any verbal or behavioral techniques used to stabilize the individual. Ongoing risk assessments are also crucial. Include evaluations of suicide or homicide risks, withdrawal symptoms, or other medical risks tied to substance use. This information helps justify the need for crisis services and informs your intervention approach. Pay attention to how the client responded to the interventions. Did they cooperate, refuse help, or show signs of improvement? Documenting their response provides insight into how effective your crisis management was. Following the intervention, clearly outline the follow-up and disposition plans. What are the next steps? Will you refer them to a counselor, recommend hospitalization, or suggest outpatient treatment? This ensures continuity of care and safety for the individual. If there were multiple contacts during the crisis, or if you gathered information from family members or other professionals, make sure to document this as well. It adds context to the situation and can be important for future interventions. When it comes to billing, avoid conflicts by ensuring that only one staff member bills for crisis intervention per client per episode, unless roles are distinctly different. For practical documentation, consider using a structured note format like the interventions, response, and treatment plan model. Under interventions, list what actions were taken. Under response, note how the client reacted. Finally, under treatment plan, outline the next steps and referrals. Include objective data when relevant, such as vital signs or withdrawal scale scores. This adds credibility to your documentation. Always ensure your notes reflected the acute nature of the crisis and do not simply restate treatment plan goals. Lastly, maintain confidentiality and accuracy in your documentation. These notes may be reviewed by other healthcare providers or used in legal contexts, so it is essential to be thorough and precise. By following these guidelines, you can create effective documentation for crisis intervention sessions that supports both clinical decision-making and administrative requirements in the context of substance abuse and addiction.